and you can kind of see this little channel where the coronary artery goes. It kind of makes this diagonal angle.
Okay.
That's the front of the heart. Right side, right ventricle over here, right auricle over here. Below this, all left ventricle, left auricle right here. Flip around to the back side. It makes this kind of T. So back here, again, underneath all this is where you find your coronary sinus back here. Now, if I look at the front, again, this is right ventricle over here. You're going to see this large blood vessel kind of coming off of the heart. This is going to be the pulmonary trunk coming from the right ventricle on its way to the lungs. Blood passes through the pulmonary trunk, which will then diverge into right and left pulmonary arteries. So I know this is kind of the right side. When I'm thinking of the vena cava, it's the right atrium that they enter into. So I'm going to be looking, here's right side, here's the right auricle. Well, the auricle is just an extension of the atrium. Look at that little hole right there.
Atrium.
Okay, and then look at this hole back here. Okay, now when they remove the heart, the blood vessel that would be here that creates that hole, right, there would be a blood vessel coming in attaching to that hole. That would be the equivalent of our superior vena cava, the pre cava. Same thing here. See this hole back here? Well, there would be a blood vessel coming in attaching to that where it's creating that hole, emptying into the right atrium. That would be the equivalent of our inferior vena cava or the post cava. So this is kind of how it sits in their body, right, with the blood from the head draining this way, blood from the rear draining this way. It's not up and down the way our vena cava are. Now here again, closer to the front, those two blood vessels, the one that's closer to the front is the pulmonary trunk. Behind that then is the aorta. And the aorta is coming from the left ventricle. So the right atrium, right ventricle rather, is sending blood out here through the pulmonary trunk. The left ventricle is sending it out here through the aorta. And then back here, like where the left atrium was, that's why I was saying, like, good luck finding pulmonary veins there. I mean, it's just a big, giant, open gash. So.
Yeah. Okay. Thank you very much.
I have to wash my hands. And then I'll see if I can find you a monitor. Let me wash my hands.